Hey everyone, I'm Amy Ali and I'm on a mission to have healthy skin, a healthy mind, and a healthy body. Welcome to my channel. It has been over 2 years since my cleft lift surgery. So, has the pilonidal cyst come back? The answer to that is no. If you have any questions regarding this topic, please be sure to leave it down in the comments below. I'll be making a dedicated video answering all of your questions. Before we get into this video, if you are a first-time viewer and you'd like more videos like this one and other health and wellness videos, please consider subscribing. It would mean the absolute world to me. You can also catch me on Instagram, which I basically update daily with health, wellness, recipes, skincare, all that good stuff. You can also follow me there and ask me questions there as well if you'd like. I make it super simple. You can find a link down below. Just click it and you'll be taken to my Instagram profile. I also have a pilonidal disease playlist here on my channel where I have stored all the videos related to this topic. I also vlogged my surgery day, so if you'd like to see that, I'll have it linked for you guys down below. All right, let's get into it. I'm gonna give you like a full body update on how I've been since my cleft lift surgery. So I got my surgery done in February of 2018. So at the time of this recording, it's been about 2 years and 4 months or so since my surgery. If you've watched my other videos about this topic, then you would have known that I actually had some complications. And it wasn't due to the surgery itself, it was mainly due to me and what I did that kind of prolonged my healing process. So my healing process took a little bit longer than regular processes do. So mine took 4 to 6 months to actually heal. I saw my doctor for a really long time compared to other patients, but it's been about 2 years since I last saw my doctor. I think I last visited him in July or so of 2018. And if you want a doctor that's located somewhere in DFW in Texas, North Texas, I will leave my doctor's name down below and his address and all that good stuff of his practice. I highly recommend them. They're amazing, amazing. His staff is amazing, so highly recommend. All right, so I'm gonna start with the category of pain and sitting. So basically for about 6 months or so after my last appointment, so basically for the rest of the 2018 year, I was definitely sensitive in the area where I got my surgery. It was just very fresh still. It was also healing at the time as well. I really feel like I'm pretty much healed at this point. And it definitely hurt to sit for long periods of time. So like really long road trips would have been painful if I hadn't gotten up and walked around for a little bit. So right now I'm feeling no pain. I've been sitting for quite a while. It's been 2 years, so for the most part now I can sit for long periods of time. The only thing right now is that if I put too much pressure in that area, for example, if I'm sitting really weird and the majority of the pressure is going to the incision area, I will feel a little bit of sensitivity, and I think that's perfectly normal. But with time, the overall sensitivity has completely improved. It's not really sensitive that much anymore, and honestly, it feels like I almost never got anything done. And as far as the sensitivity and the numbness of that area, when I first had the surgery, for a while there, it definitely felt again sensitive and numb in that area, like I couldn't feel it. But now I can definitely feel it again, and sometimes when I'm wiping I do feel like a little bit of sensitivity in that area, but that's just maybe like once a month. It's not very often that I feel that, but overall the majority of the numbness has gone away in that area and all is well. All right, so physical activity. So for about 6 months to a year after my last appointment in 2018, I did not do a lot of physical activity. I was honestly just kind of scared for that area, especially when it comes to things like squatting and bending and things like that. I was just afraid that something bad would happen. So I kind of avoided doing exercises that really emphasized that area. The only thing is that I feel like my lack of movement contributed to my weight gain. So that's the biggest downside, I guess, to that. But I highly recommend just making sure that you are moving your body, whether it be your upper body, your lower body, whatever. There are workouts out there that you can do that will not put a lot of emphasis on that area, but of course, always be safe. Consult with your doctor before you do anything as far as physical activity goes, or like lifting weights and things like that. They will know best. Now, 2 years later, I definitely do everything basically. I do squats, I do lunges. I mean, I can do basically anything that a workout consists of. The only thing that I still avoid to this day, and honestly, I've done this my entire life, I don't put a lot of pressure on the tailbone. Now, the tailbone is where I had my surgery, and even before I had my surgery, it would still hurt to put pressure on that area. Even as a kid, it still hurt to put pressure on that area and to kind of balance my entire body weight on my tailbone. So regardless, I really do not do that. When it comes to workouts that require me to be in that position, I either use like a Bosu ball that doesn't require me putting my butt on like a hard surface, or I just lay on my back and I can still get a good workout that way as well, doing similar positions and similar movements. But I just really try to avoid, just putting all the pressure on that area. A little side note, a lot of people have reached out to me on Instagram asking about how it looks after the surgery, if it looks like you have a flat behind. And honestly, I had the same worry. I asked the nurse at my doctor's office, would I be able to work out still? Would I be able to still work that area of my body and build the muscle and things like that? And what I want to do is I'd like to create a series that is focused on the glutes, that's focused on trying to build that area of my body and seeing, how my body can, I guess, transform in a way after the cleft lift surgery. I just want to note that I'm not a personal trainer. I'm not a professional anything physical training related. So I'm just someone who enjoys working out, and I just want to see what I can do for my own body. So if you want to see that, if you want to see a series dedicated to building the behind post-surgery, post-cleft lift surgery, and you want to see what that could possibly look like, please let me know in the comments down below. And the last category is appearance. I get questions about this a lot. A lot of people are kind of self-conscious and worried that their area is going to look weird, especially when it comes to being intimate. And I have to admit, I've been so extremely blessed and lucky to have an amazing husband who loves me and accepts me as I am. We were together, we were already married whenever I had the surgery, so he's seen it all. He's actually helped me with that area when I was, freshly out of the surgery room. He's helped me just take a look at it, make sure it looks okay and all that stuff. So he's amazing. And I really feel like if you are with a great person, they will accept you for however you look, and they will be understanding. If they are mature enough, they'll be understanding of what you had done and why you had it done and all that good stuff. So I don't think it should negatively affect you in any way when it comes to intimacy or when it comes to relationships and stuff. But it's up to you as far as how you want to address that topic with them. But anyway, a question I get a lot is, how does it look? How do the scars look? And honestly, the scars have improved so much with time. So first, I have 3 scars, okay? So I have 2 drain hole scars and 1 incision scar. The drain hole scars have improved so much over time. At first, I was super worried about them, but they look fine. They have turned from like a red color to more of like a whitish color, and also they are a little bit inflated, it seems like. So I've previously referred to them as like little buttons. They kind of look like buttons, and now they're just like a lot softer. They're not as like hard and I guess bubbly as they were before. And also they have moved, which was interesting. So they were once in a certain area, and with time they just kind of moved. I don't know how to explain it completely, but they're not in the same space that they were before. They just moved up a little bit. And then the incision scar is also improving a lot. It is more of like a white color now. And just like any scar, it's not completely like flush with the skin. So it's a little raised, but that's really no big deal. It definitely goes right along the rest of the line, if that makes sense. And honestly, the only thing that I wouldn't necessarily wear would be like a thong bikini. I wouldn't feel comfortable wearing that regardless. That's just me. But besides that, you can't really tell that I had surgery. Not at all. With regular clothes on. So overall, it's been almost 2.5 years, and I can basically do everything that I used to do before, and I've actually been doing more as far as physical activity and working out than I did before anyway. I just have some awesome scars that show that I've definitely been through some stuff, and if I can do it, then you can definitely do it as well. This has been one heck of a journey, you guys, but it's been completely worth it for me. And I'm so glad that I got this done. Don't forget to leave your comments and your questions down below so that I can film a Q&A video for you guys very, very soon. I hope you guys have enjoyed this video. Please subscribe if you have. And also don't forget to follow on Instagram if you'd like to. I love you guys so much. I have a ton of other awesome videos on this channel going into other topics as well as far as health and wellness goes. And yeah, I will see you guys in another video.